no animal lives long enough, meaning by that the emotional attachment to a pet is so great, and however much you try to adapt your feelings and prepare yourself for parting from an animal, it never really works. Yes, we are seeing animals live longer, much as we are in humans, and that probably is accounted by several factors, one of which is diet, that is adapted to the animal's needs throughout its age. Medicine, of course, where animals would have suffered with, say, chronic arthritis. We have drugs now which can make life very much more tolerable, so that whereas an animal may well have been put to sleep at an earlier age, now we can go on longer. One of the sadnesses that one does see, and one has to obviously adapt lifestyle to, is where people have several animals, and probably because of their own emotional feelings, they have them at different ages. And it's when you get an old dog who has arthritis and can't go for the walks with the younger dogs, and to some extent will sit at home and isn't happy about it. But all these situations have to be adjusted so that, yes, the two dogs will go out for a walk and then perhaps the younger dog will be taken out more frequently. But there are problems with things like with old age, naturally, but many people somehow adjust to it. In answer to your question, though, yes, animals are living longer.
Are you seeing then different sorts of illnesses affecting those particular animals then because they are living older? Are you seeing more cancers or more arthritis or those sorts of things that now we're having to deal with?
Those two illnesses that you have mentioned, cancer and arthritis, yes, very much more. On the other hand, of course, that progress, I wouldn't put it on the same par as in human cancer, but there is progress all the time so that these things can be treated in a much better way than we used to when I first qualified.
And with particular animals, can you give particular examples of the things that you're seeing that seem more frequent?
Certainly the arthritis, that again, if you only went back perhaps 20 years, we were limited on the amount of, or the types of drug we could use. Many advances have been made, almost parallel as with the human, and I'd like to think that there are certain drugs on the market that are being used in humans that were in fact designed for animals, and then they have found a use for them in humans. Certainly arthritic change is one of those things that we do control more, and also that dogs suffer from certain injuries. That doesn't mean road accident. These are what I call natural injuries, the cruciate ligament, which perhaps people a little bit older than many of your listeners would remember as what Paul Gascoigne suffered from. But it's a very common injury in footballers, and we now, the operations that can be done for that particular injury are very much more effective, which of course keeps the later arthritic change to a lower level. But certainly with the cancers, whereas again when I first qualified, very few cancers were treated with chemotherapy or radiotherapy. Now these are all accepted techniques which we use in animals. I think the only thing that we have to emphasize, however, though, is cost involved. So many people see things on the television and say, I want that for my animal, which is obviously a good thing, but they have got to realize the cost involved in these things.
Are you seeing, with the current economic climate, that cost factor actually coming into play in how people look after their pets? Are people neglecting them more, do you think?
I regret that this is a factor. The number of pets being abandoned has increased enormously since the recession. What I'm really trying to say is it's not as a vet in private practice in Folkestone that I see this problem, but that the RSPCA, their rescue centres, are seeing an increase. Where vets get involved, where the heart is really torn with these cases, is if these animals cannot be found homes, what is the alternative? The alternative is, of course, painless euthanasia, but to put a healthy animal to sleep is the worst thing for a vet to have to do. But I regret that. What is the alternative?
Yes, having taken on the responsibility of pets myself, have, had to put some of my animals to sleep when they've got old and ill and beyond medical care. So, and it's a distressing place to be, and because they are members of the family. So having to do that to animals which are not ill, it seems criminal, really.
Yeah, it is. And I've got bad news for you, Helen, because I'm much older than you are, and it doesn't get any easier the older you get.
Oh dear.